my friends, we're back with the same topic, which is very important, torque in orthodontics. Now we're going to address another situation where we have to look for in our treatment, in our practice, in order not to have many mistakes. For example, am I giving the right reading of the torque? Am I giving enough attention to understand the topic, the torque that I'm talking about? Am I paying enough attention to what is going to happen when I do this kind of positioning of the rectangular arch wire inside the slot? Is it what I'm doing when I put my first rectangular wire in my patient? I'm running a sequence of wires, so I'm going to, I start with a round wire, a night-tie wire, and I go with my sequence, which I use first night-tie wires, super elastic or thermal night-tie wires. Then I go to stiffer round wires, steel round wires, like stainless steel round wires, 016, 018, 020, and then I go inside, I get in my first arch wire, rectangular arch wire, which is usually 1725, because I use 2230 in my slot. So I'm used to doing the first rectangular wire is not that thick. So I start with this rectangular wire, and now I have to evaluate the anterior torque which is present in my rectangular arch wire. So when I grab an arch wire from my stock, I just look at him. It's not round, it's not twisted. It's completely neutral, because I buy it this way. I buy my rectangular arch wire with this form, form which comes from the company, and then I can avoid doing, if I need to avoid doing this twisting, depending on the situation. What I mean is, when I want to do some torsion of the arch wire, I do, and I'm going to show to you how to do this and practice in your practice, and you will look anytime you want for these videos that I'm going to send to you, that I'm going to show to you in this class, not in this class, specifically this class, but in this course. I'm going to show you how to do, and you can practice, and you can come back, you can rewind the video and do it again and see it again and see as many times as you want in order to apply it in your day-to-day practice like it is normal, like it's natural for you, okay? And you are going to see how to do it. It is easy the way I do the torque. There are two ways to do the torque and the practice, and I'm going to show it to you, and you are going to have the opportunity to go back and go forth and do the torque anytime you want, and every time with this natural manner, okay? So the torque. First of all, we're going to address the anterior torque, the anterior segment of the arch wire, which is obviously going to get in the anterior segment of our dental arch. So I'm going to apply a torque or not, and I'm going to see how the torque is. And this is the real torque. We call it the real torque because this is the torque which is in the arch wire, not the torque inside the slot, or the torque that is felt, if I can say like this. It's the torque that the arch wire applies to the slot. No, this is the torque itself, the torsion itself. This is the torque that we apply to the arch wire, which sometimes has nothing to do with the torque, the relative torque, which is the torque that the tooth or the teeth will feel when you put the arch wire inside the slot. Okay, so let's move on. First of all, I'd like to see how the torque comes, and it comes almost always this way, completely neutral. So meaning there is no torsion in the arch wire. There is no torsion in any segment of the arch wire. This is the way it comes from the company from which I buy, and this is the way I put in the majority of my cases. The first arch wire is it goes with a neutral torque. Not always, no, not always. There are some cases when in which I have to apply some kind of torque. You are going to see this in a few classes ahead, or and maybe I just call your attention about this in this very class here, but we are going to see. We're going to see how it works. So first of all, the neutral torque. There's no twist of the wire. The base of the wire, if you just cut your arch wire here, let's think about this arch wire as being a segment of the arch that we buy, and we just cut this arch wire in the middle, like the middle of your midline. You cut this and you're seeing it now. You're looking for this segment here. You are looking for this position of the rectangular segment. When you place it in the glass slab, you place it. If you just look with a magnifier glass, you are going to see this here. No torsion. It stays parallel to the glass slab. So this is no torque. You can do this by looking at the glass slab, but it's very difficult because sometimes you cannot see these slight differences of angulation of the arch wire. But the best way to do this is using our plier. This is a 142 plier, 142 plier. It's a plier meant to deal with rectangular arch wires. So this plier, I grab the wire, the segment that I want to evaluate, which is the torsion, and if it passes like at the same line of the middle of the plier, I'm going to see that there is no torsion at all in this arch wire, this rectangular arch wire. So in this case, we have no torsion. We have what we call neutral torque, so-called neutral torque. This is a real neutral torque, meaning no torsion at all, okay? So in this case here, it's different. Now we don't have the neutral torque. We have a torsion that is made in the anterior part of the arch wire, as you can see here. As I told you before, this is a segment. This is like we have cut the arch wire in the anterior, in the medium part of the anterior segment. So if we look at the midline, we just cut the arch wire here. This is the anterior part of the arch and the arch wire also. So we have now a torsion that was made in this kind of situation here. A torsion was made here in order to achieve any specific situation. So we won't address it now, but you have to understand that. Thinking about the upper dental arch, when I have this torsion like this here, forming this angulation between the glass slab and the segment of the arch wire. So let's see it here again. We have this segment here, and it's not neutral anymore. It's not parallel anymore. We have now an angle formed here between the glass slab and the base of the arch wire. We call it a negative torque, meaning for the anterior part of the upper arch, upper dental arch, if I put this arch wire this way, it tends to give to the anterior dental segment for the incisors. For example, if I do distortion from lateral to lateral, from distal to distal of lateral, upper laterals, when this arch wire gets inside this slot this way, the upper arch, the upper dental arch, the upper brackets, the anterior segment of the upper brackets, so we have a negative real torque. Sometimes this real torque, it won't move, it won't incline the anterior teeth negative. It won't incline palatally the anterior teeth because we have this relationship between the real torque and the relative torque. The real torque is one thing. It's just the torsion of the arch wire. What is present on the arch wire? It doesn't mean that you're putting this kind of torsion, which is negative for the upper, it's going to incline anterior teeth palatally. It doesn't mean that, because you have to understand this relationship between the inclination already present in the slot, which depends on the inclination of the tooth or of the teeth, the segment of teeth, and the inclination of the arch wire itself, the torsion on the arch wire itself. So this relationship between those two situations, the torsion and the inclination that the distortion will find when it gets inside the slot, it represents the movement that the teeth will feel, the teeth will have. Okay? It's not clear now, but it will be clear in a few moments. Let's go further. So this is a negative torque for the upper part of the arch. Okay? If we put this way, the same torsion here, we put this way with this inclination in the anterior segment of the lower arch, it is different. It's going to tend to give a buccal inclination of anterior teeth. So in this buccal inclination, we call it this. This is a positive torque this way, put in this way in the lower arch. So it depends on the way you insert this rectangular arch wire. If it is upper or lower, it will be different. So if we want to do this, the same inclination, the same torque, the same real torque for the upper and the lower, so this is a negative torque in upper arch. For the lower, I have to put the arch wire upside down. I have to invert the arch wire for it to have the same reading, the same tendency to do the inclination in the anterior segment. So this is negative. If I want to do the same thing to the opposite arch, I do the inversion of the arch of the arch wire in order to have the same signal of torque. It's negative this way, and to have the same here to the lower arch wire, I do the inversion of the arch. Okay, so another way, which is very clinical way to understand the torque, the real torque, is grabbing with the anterior segment, which we are now evaluating. We grab the anterior segment of the arch wire with our plier, and the posterior part of the arch wire, it may go down, up, or, as we saw, neutral. So here we have a different situation from neutral. It's not neutral anymore. This is now a negative torque for the upper arch. Imagine this. When I go, like, I grab here and I go horizontal here, what is going to happen in a medium situation, in an average situation? What is going to happen here to the incisors when I put this wire inside the slot? So when I go up here to the upper arch wire, when I put it inside the tube, inside the posterior slot, the posterior teeth slot, I'm going to change the inclination in an average position. I'm going to change the inclination of anterior teeth going negatively. So it goes towards palatal, which is a negative crown torque, because we are seeing the crown here, because the crown is what we see when we treat patients. The crown is what Andrews referred to when he did his 6 key of normal occlusion, of an optimal occlusion or ideal occlusion, as you want to call it. So we will see and we will name the torque according to the inclination of the crown. So when you go to the literature, many people refer to the torque referring to the root, because it moves more than the crown. It's obvious. But when we see things, we see the crown. When we want to do things, for example, I want to do a positive crown torque in order to have a more aesthetic, a more beautiful smile, because this torque is too negative and I want to go a little bit vertical or positive, neutral or positive torque. So this is what we call the crown. We refer to the crown. So in this situation here, this is a negative real torque, meaning a negative real torque when we think about the crowd, okay? So this is what we think, this is what we see, and the opposite, again, taking into consideration that we are going to insert this arch wire this way it is, and the upper dental arch. We're going to insert in the upper dental, in the upper brackets, in the anterior region, this way. So we grab the arch wire, and it has this inclination. When we grab it, the anterior segment of our arch wire, it is not neutral, it goes up. So if I insert this arch wire inside the slots of the anterior segment, we are tending to move it, inclining the crown towards buccal, which we call a buccal inclination, a positive torque, a positive crown torque, okay? So if we want to do the same thing, we want to have a positive real torque to the lower arch, to the lower dental arch, I have to invert it, okay? It will be clear in a few moments when you talk about the relative torque. So we have here three possibilities of real torque: neutral, negative, and positive. So what is the torque? Just the torsion. The real torque is just the torsion in the arch wire, the torsion that we make in the arch wire, the torsion that we give to the arch wire, okay? So those three situations we call neutral, zero inclination when I grab the arch wire, zero angulation here. We have the negative torque, real torque, when we grab the anterior part of the arch wire and it goes down, meaning inserting this way in the upper dental arch. So we have now a negative torque, negative real torque, okay? And here we have the positive real torque. So we have these three possibilities thinking about the anterior segment of the arch wire, okay? Just for now, just stop a little bit, go backwards here with the explanation, and we can rewind this. You can go to the beginning of our explanation and see it again, because I know that for many people that is not used to think in this way, it's a little bit tricky to understand this real torque. But we're going to intensify this learning when we see the posterior part of the arch wire. It's almost the same thing. Just for now, these three torques: negative, positive, and neutral, okay? So make this mental exercise now to remember, okay? Thank you, guys. See you in a few moments. Bye-bye.